Good morning, Ma'am Jonalyn Corpus and Ma'am Amparo Miguel. I'm Eunice Buxit from Section B. I'm a nursing student from Mary Charles College. Today, I'm going to perform the skill Vital Signs Assessment. Vital signs are used to measure the body's basic functions. These measurements are taken to help assess the general physical health of a person, give clues to a possible disease, and show progress toward recovery. The normal ranges for a person's vital signs vary with age, weight, gender, and overall health. There are 4 main vital signs: body temperature, blood pressure, pulse, heart rate, and breathing rate. The purpose of this skill is to serve as a baseline data to help assess a person's general physical health, to give clues about possible disease, to show progress towards recovery. Prepare the necessary equipment materials to be used and check their functionality. Watch with second hand. Pencil or pen, paper, or flow sheet, tri-pen, stethoscope, thermometer, water soluble lubricant, disposable plastic cover for probe, sphygmomanometer, pulse oximeter, analog scale, the universal pain assessment tool, tissues or wipes, wet and dry cotton balls. Before we start the assessment, we must perform hand hygiene, wear our gloves and mask. Indicate your name and your birthday.
My name is Joy Michelle Benesena and my birthday is April 11.
Okay. So, ma'am, the first assessment is pain assessment. Ma'am, do you feel any pain or experiencing any pain in past 24 hours? So, the next assessment is pulse saturation assessment. So first, clean the site with alcohol wipe before applying the sensor to avoid interface with the measurement. If the client has a nail polish or acrylic nails, make sure the LED and photodetector are aligned accurately, that is opposite each other on either side of the area. Ensure that the bar of the light or wavelength, the phase of the oximeter, punctuates with each pulsation and reflects the pulse volume strength. So after you get the pulse saturation, make sure to record the pulse rate in worksheet. Next is temperature assessment. So before using the thermometer, make sure to disinfect first using alcohol pads or cotton balls soaked in alcohol. Disinfecting thermometer from tip to the body. Circular motion. And now place it to the patient's arm, underarm. Wait until the beep sound for the result of temperature. So, ma'am, your temperature is 35.7. So, you don't have any fever. And after using the thermometer, disinfect it again from body to the tip in circular motion. Next assessment is pulse rate assessment. So, select the pulse point as required. Normally, the radial pulse is used unless contraindicated. Place tips of 2 or middle 3 fingers lightly and squarely over the pulse point. Here. Make sure to not use thumb to assess for pulse. So, count the pulse for 1 full minute. Assess also the pulse rhythm and volume. After getting the pulse rate, record the pulse rate in your worksheet. Note the finding, which includes the pulse rate, volume, and any pulse deficit in client's record. Next assessment is apical pulse assessment. So, first is locate anatomical landmarks to identify the point of maximal impulse or fifth intercostal space mid-clavicle line. First is palpate the angle of Louis. So here just below the suprasternal notch between the sternal body and manuborium felt as prominence. Slide down your index finger down each side of angle to find the second intercostal. So first is here. Place your middle or next finger to the third intercostal space. Here. So, place your middle or next finger to the third intercostal space. Continue palpating downward until you locate your fifth intercostal space. So here. Carefully move your fingers down to the left side of the sternum to fifth intercostal space and laterally to the left mid-clavicular line. Then normally the apical pulse is palpable or just medial to the MCR. So first so we're going to use a stethoscope. Before we use, you need to clean the earpiece and diaphragm or stethoscope using alcohol swab. So from inner to outer. Next is the earpiece from inner to outer too. the earpiece of the stethoscope into its ear. Tap lightly on the diagram to be sure it is in the active side of the head. So please place the diagram over the PMI and oscillate for heart sound. S1 and S2 heard as blood belt. When heard with regularity, use watch second hand and begin to count the rate. Count of the one is first sound heard after timing begins. Count the pulse for 1 full minute. Make sure to assess the rhythm and strength of the heartbeat by noting the pattern of intervals between beats. And after apical pulse assessment, record the pulse rate in your worksheet. Next is respiratory rate assessment. After taking the pulse rate, do not remove your hand over the client's wrist or place your hand over the client's shoulder. Observe and continue respiratory rate. Heart counting while looking at the second hand of watch. Count for 1 full minute. Observe the character of respiration, depth of respiration by degree of the chest, while movement, shallow, normal, or deep. Rhythm of cycle, regular, or uninterrupted by watching the movement of the chest. After the respiratory rate assessment, record the pulse rate in the worksheet. Next is the blood pressure assessment. The elbow should be slightly flexed with the palm of the hand facing up and the arm supported by the heart level. Expose the upper arm. Wrap the deflated cuff evenly around the upper arm. Locate the brachial artery. Next is, if this is client's initial examination, perform a preliminary palpatory determination of systolic pressure. Palpate the brachial artery with the fingertips. Palpate the brachial artery with fingertips. After palpate the brachial artery with fingertips, after palpating the brachial artery, note the pressure on the sphygmomanometer at which the pulse is no longer left. So her pulse stops at 110. So 110 added to 30. So we're going to pump up the cuff until 140. Cleanse the earpiece and the bell. So now I'm going to auscultate the client's blood pressure. blood pressure is 13/83. So her blood pressure is normal. So after taking her blood pressure, record the pulse rate in the worksheet again. Lastly is the aftercare. After the procedure, assist the patient to the comfortable position. Thanks the client for her or his cooperation and other assistance, whatever needs to the client that may arise. Place the call bell near the client. And then, next is side drills up for safety. Gather all equipment and dispose all disposable supplies that we use. Remove the face shield or goggles. Retain the mask. Remove the gloves and perform hand hygiene. Lastly, it's for the documentation. Document all the results obtained, time of assess, any outward signs and symptoms, noting the cardiorespiratory problems like anxiety, dizziness, discomfort, and pain. Dropping and plotting of the results.